This is Katie Beard recording for Lindsay White.
I'm going to first walk in. I'm going to perform hand hygiene. I'm going to apply gloves. We'll set next size bigger. I'm going to identify my patient using two identifiers. Check it with their wristband, making sure that it's my patient. I'm going to let them know I'm going to be feeding you through your tube today. I'm going to raise the bed to a comfortable working level.
Oh yeah, no, you're good. So yeah, but the only thing that I noticed was just like, good thing you kept saying it.
I'm going to also put it in high Fowler's position, at least 30 degrees. Actually, I'm going to wait to do that. I'm going to listen to their, and oscillate and listen to their bowel sounds.
You missed, you went back and got. Yep.
Oh, okay.
And I was like, whoa. And then I went back and I was like, I know there was a couple that I like.
The residual volume one?
Yeah.
Listening for up to 5 minutes on each quadrant if I cannot hear anything. I'm also going to measure their abdomen at this time. I'm going to make sure that my insertion site is free from any drainage damage, any irritation, any redness, anything out of the norm. I'm going to raise the bed to high Fowler's to help with digestion. I'm going to get a baseline weight on my patient, check their, look over their labs, look at their fluid volume, make sure there's no excess or deficits, check the electrolyte and metabolic labs, and make sure there's nothing like hyperglycemia or anything. I'm then going to remove my gloves and perform hand hygiene. Put new gloves on. I'm going to review my doctor's orders for the amount, the frequency, and the rate. And also for the flush amount and the rate. I'm going to identify my patient one more time, making sure that it's the right one. I'm going to get all of my supplies. I'm going to measure out my liquids. Before doing that, I'm going to look at my formula, make sure that it's not expired, make sure it's for the right patient, make sure the integrity of the bottle is good, that it's been shaken well, and that it's at room temperature. Our order today is 40 mLs of formula and 30 mLs of flush. So I'm going to go ahead and do that at eye level. Okay. I'm going to make sure that I'm always leaving this clamped off or closed when not in use, and that I'm getting new equipment every 24 hours. I'm going to start by checking the placement of my tube. I'm going to use 30 mLs of air. And I'm going to listen while I push that in. And then I'm going to pull back all of the residual until I feel resistance. I'm going to note the amount and the appearance of it. And this needs to be done before every feeding and every 4 to 6 hours for continuous feeding. I'm going to push all but 1 ml back. Closing that off. I'm going to put that on my pH paper to test. I'm then going to start the feeding. I would discard my gloves, wash my hands, perform hand hygiene. I would start with my flush. Let gravity work its way down there. And then my formula. making sure to clamp it in between. Again, keeping this catheter clamped anytime I'm doing anything. I'm going to then clean around my patient's entrance here with soap and discard, and then I'm going to dry it. Or I'm sorry, with warm water, and then I'm going to dry it. I'm going to then place a bandage on it if needed, or if it's in the orders. Otherwise, it can stay open, but just dependent upon what the orders say. I'm going to let my patient know that he needs to stay in high fallers for at least 30 minutes after his feeding. I am going to lower the bed. Oops. It's already lowered for safety reasons. I'm going to remove my gloves and apply new ones. And then I would perform oral hygiene, and then I would remove my gloves again, perform hand hygiene, and then I would, for the evaluation process, I would make sure to manage his lab work, watch his respiration, and his comfort level.